So, Dr. Scholz, today I want to talk about risk and family history when it comes to prostate cancer. So first of all, can we talk about what would kind of cause just the risk of prostate cancer in general?
Yeah, people that are at higher risk are probably age is the number one thing. 99% of men that get prostate cancer are over age 50. So as we get older, it gets more common. Dr. Klotz likes to say that you can put a percentage sign after your age, and that's how likely it is that you harbor prostate cancer. And of course, that's including these little tiny harmless grade 6s that you don't even want to know about. More consequential prostate cancers are nowhere near that common. So you have age. The other thing, of course, race. African Americans are at higher risk. Latinos are at somewhat lower risk than Caucasians. Then family history, which I think we're going to talk a little bit about today. If you have a brother or a dad, then your risk goes up quite a bit. There's a genetic mutation called BRCA or BRCA that increases men's risk of getting prostate cancer. And lastly, we're talking about dietary practices, being overweight. All of these things can predispose to a higher risk of getting prostate cancer.
I have a lot of guys who I've talked to who their dad has had a certain type of prostate cancer, maybe a Gleason 9 or 10, and they think they're exactly going to get that exact type of prostate cancer because their father had it. So can you explain why would that be? Is that possible? And if not, how is prostate cancer so different?
Well, it's like inheriting anything. If your dad is a famous race car driver, has amazing skills, and you're his son, there's no guarantee you're going to be able to go out and win races in NASCAR. However, it is possible that you will. And so heritability is kind of a hit and miss thing. We do know that if someone's father had a very aggressive cancer diagnosed at an early age, that their sons will be at somewhat increased risk of having a similar problem. And of course, they need to screen more carefully. Things have changed so much, so what might have been a sad story for someone's father 20 years ago when we had no technology to treat people with, could be quite a bit different, even though they caught the same kind of cancer. But there's no way you can say, well, he had it, therefore I will have it. Just like you can't say that about anything you would inherit from your parents.
So this is a question a patient asked me not too long ago, and really they found out that their father had prostate cancer and they were kind of worried that they were going to get it. They were wondering about diet. So they wanted to start a vegan diet or vegetarian diet and stay away from red meat just because their father had had prostate cancer and they knew about that family history. Is that something you would suggest?
I think that it will make a difference. Telling people what to eat is fraught with all kinds of challenges. It would be wonderful to say, if you just eat a vegan diet, you'll never have a problem. Of course, there's a lot of great things that happen with good diets. I mean, less heart disease, reduction of cancers across the board. And yes, probably it would help reduce the risk somewhat. It's not going to be a get-out-of-jail-free card where nothing bad will ever happen to you if you eat the right diet. But if you want to play the odds, and if it's not as challenging for you to decide what you're eating like it is for so many people, why not? Yeah, do it.
If you would like more information about anything that we talked about today, you can visit pcri.org. Please subscribe to our YouTube channel. This helps share awareness of all of our prostate cancer videos across the platform, and we hope you have a great week.